Hi, everyone. Welcome to our second workshop on addressing health disparities in central nervous systems disorders. My co-chair is Dr. John Crystal from Yale School of Medicine, who unfortunately is not able to join us today, but he's ever present in the foundation of the webinars and workshops that you'll see for this important topic. In fact, we are part of the Neuroscience Forum in the National Academies, and we thank them very much for indeed highlighting this important topic of health disparities in CNS disorders that don't normally get a lot of attention. And in fact, the first workshop, I hope if you didn't join us, that you'll go back and listen to it. It was quite informative and invigorating. So for this workshop series, we have a number of objectives that we wanted to accomplish. Next slide. And in regard to, for example, reviewing the current state of knowledge regarding health disparities in CNS disorders, and really the evidence needed to address gaps in our understanding, including in areas that are absolutely undervalued and neglected as a reflection of the current makeup of the neuroscience research workforce even. We wanted to explore available evidence on the impact of psychosocial and environmental factors, for example, exposures to environmental toxins, racism, and discrimination on CNS disorders, and how they contribute to health disparities. We want to consider models of research approaches and other models designed to enable better inclusion of underrepresented and excluded populations throughout the entire research and development trajectory for CNS disorders to really generate more robust, generalizable, and equitable findings, and also to highlight case studies and available evidence of their effectiveness. And absolutely, it's important to explore potential multidisciplinary collaborations, for example, among basic mechanistic science, cognitive neuropsychology, epidemiology, and technical development, because we really need to further elucidate these topics to be able to rigorously combine methods in these respective fields to move us forward. So this second workshop will really discuss what common disparities exist across a variety of service environments and consider case studies and models of research approaches that will enable better inclusion of underrepresented and excluded populations. I think that should be in the next slide. And this is really, yes, thank you. This will be covered across two sessions today in this workshop. The first one really focusing on evidence of disparities in access to care, and then opportunities to increase access to care. We've had a great planning committee, and we really thank them for their service. I think the slide before had shown all of the members of our planning committee who really have done an incredible job, and I will say a very difficult job, because there is some amazing work being done throughout the US on this topic that we really want to highlight. And of course, we wanted to bring this to everyone's attention. So we thank the committee, John and I. So a proceedings document of the presentation and discussions from the workshop will be prepared to reflect what transpired at the workshop. It'll be published by the National Academies Press and will be publicly available. All views presented in the report will be those of the workshop participants. The report will not contain consensus recommendations. The recording and presentations from this workshop will be available for viewing on the National Academies website in about a week or two. Throughout today, there will be opportunities for attendees to ask questions, and we encourage you to do so through the Q&A box located below the live stream. While the workshop speakers will be answering some questions live, we've asked that they respond to those not addressed on the Slido platform immediately following the workshop. We kindly ask you to keep your questions concise so you can get concise and critical answers. So as I said, the first workshop was really informative, that focused on structural and social determinants of risk. This workshop will now continue looking at disparities in access to care. We started off with a keynote lecture by Dr. Christine Crawford. Dr. Crawford is an adult and child psychiatrist based in Boston and is an assistant professor of psychiatry at Boston University School of Medicine. She's also the associate medical director at the National Alliance of Mental Health, and she's authored multiple book chapters on mental health disparities, sociocultural issues in psychiatry, and actively engages in a number of community outreach initiatives. Dr. Crawford will talk on lived experiences, caregiver community as a community advocate speaker.